This is Bill Keck speaking. I'm chair of the Academic Health Department Learning Community, and it's my pleasure to welcome you all to today's meeting, today's webinar. Delighted to have you join us. Before we get into the meat of today's meeting, though, I'd like to ask Janelle Nichols, one of our staff members, if you would, to sort of go over how things work with the webinar. So, Janelle, if you would, please.
Sure. Thanks, Bill. Just a few housekeeping items. If everyone could please mute their phone or a microphone if you're using one throughout the webinar, that would be great. Also, if you've dialed in using your phone, could you please mute your computer speakers? Oftentimes there can be an echo caused if so. Also, you'll see to your top right-hand corner a file. There you will find links to download the meeting materials for today. So there's the presentation slides as well as an example AHD Affiliation Agreement, which is for the Jefferson County Department of Health and the University of Alabama at Birmingham School of Public Health. And the meeting today will be recorded, and we'll make the archive available following the meeting. And you'll see in the bottom right-hand corner a chat box, so please use that box at any time throughout the meeting to make comments or ask questions. In addition, once our presentation for today has completed, you will be able to unmute your phone by pressing *6 to join the discussion. Thank you.
Very good, Janelle. Thank you. Well, some of you, I think, are new to us today, so I just want to review very briefly where the Academic Health Department Learning Community comes from. We are really a part of the Council on Linkages between academia and public health practice. For those of you who are not familiar with us, we really are an organization made up of representatives of 21 now different national public health organizations that are listed for you on the right-hand part of the slide. And on the left, you can see what our mission is. And so essentially, we're focusing on trying to develop links between academia and public health, and now increasingly the healthcare community. We try to advance strategies to build and strengthen public health infrastructure and to create a process for continuing public health education throughout the career of public health professionals. The next slide, then. Sorry. So, the Academic Health Department Learning Community itself is, I think, approaching the end of its 4th year. I think we've just begun our 5th year. We're a national community. We've come together to support the development, maintenance, and the expansion of academic health department partnerships. So we're doing what we can to facilitate a shared exploration of just what it means to be an academic health department and to learn together about how to move academic health departments along and improve their impact, improve their reach. We bring together a variety of public health and healthcare professionals, share their knowledge and experience, and work together to try to create academic health department resources and tools. And you can certainly access some of them on our website if you're interested. You'll hear more about that in a little bit, I think. We have meetings and webinars during the year. Most of these are electronic, that is by telephone conference call or by webinar. But we do our best to give people an opportunity to engage in discussion, to look at the resources, to get at the tools that we have, and to receive some guidance to support academic health department efforts. Again, a little bit more on that later. And the next slide. So with that, let me get to today's speaker, who is Bryn Manzella. Delighted to have the opportunity to introduce her to all of you. Bryn is the Director of Quality Improvement within the Jefferson County Department of Health in Birmingham, Alabama, and she leads its Division of Quality Improvement and Support. She has undergraduate degrees in Health Administration and Health Education from East Tennessee State University and received her Master of Public Health degree in Health Education and Health Behavior from the University of Alabama at Birmingham. Bryn serves as the Academic Health Department Liaison for the Jefferson County Department of Health. And as part of this role, she's a preceptor for pharmacy residents, assists in grant development and management, provides lectures for academic partners, and represents the Jefferson County Department of Health on the boards, councils, and committees of the Health Department's academic partners. So she's in a good position to really tell us about this. And so, Bryn, please, the floor is yours.
Thank you, Bill, and welcome everybody, and a special welcome to those of you who are new to the Academic Health Department Learning Community. I hope you will find this to be a group that can really help you and support you in your work as I have. Just a little bit about the Jefferson County Department of Health, because we are maybe a little unique, as all of your health departments are a little bit unique. We are in Birmingham, Alabama, the largest city in the state of Alabama, serving a population of right at 659,000 folks. Of our population, about 42% are African American and about 4% are Hispanic. So we're a very diverse community. And unfortunately, we have a fair amount of poverty in our community. About 20% of our folks are impoverished at the 100% federal poverty level, with almost 10% of those being at 50% of the poverty level. So we certainly have some challenges for ourselves. Our health department might be a little unique to some of yours in that we provide primary health care. We have adult health, pediatrics, and family planning directly provided by our staff, and maternity services are provided through a waiver program but housed within our 4 health centers. We also provide specialty care clinics including STD, tuberculosis, travel, and dental. So one of the things we really deal with a lot is a fair amount of health disparities. In fact, one of the more alarming statistics for us is that our infant mortality rate is 15.5 per 100,000 for our African American community compared to 4.3 for our white community, something we're certainly working to work through. And before I start, I'd like to recognize that there are many, many partners that work with me in this academic health world here in Birmingham, and to each and every one of them I'm very much indebted. They make my job a lot of fun. So how did we actually become an academic health department? Well, honestly, it wasn't a planned activity. But many, many years ago, actually 25 years ago, someone had a great idea. This individual is a staff nutritionist with us, and she felt that there was an opportunity to bring students into the health department as young dietitians or dietitians in training to help them understand better the role of public health dietetics. She also recognized that by having students, we could spread our services a little greater, that we could provide that real-life training experience. And I think all of us in public health know if you can do what you do in public health, you can probably do it in any place. And so many of our clients bring multiple challenges to us to deal with. And it was also, she said, an opportunity for us to sell public health as a career to these young folks. So she was very convincing, and our health officer at that time said, well, let's give this a whirl. So a preceptorship was created in public health dietetics in conjunction with the University of Alabama Roll Tide Department of Human Nutrition. And this ended up being sort of a catalyst for moving us into what we consider ourselves to be now, which is an academic health department. This evolution really did sort of come naturally. There was sort of a recognition both on our side of the table and also with some of our academic partners early on that there is a link between public health and public health academia, and that there are benefits that can be shared on both sides of the table that can come from having a formal relationship. So having some experience with these dietetic interns that had been positive for our organization, we began to think greater and beyond that. So probably what, to me, really set us apart as an academic health department was a formalized affiliation agreement and then some subcontracts with academic agencies, probably very similar to what many of you have. Our affiliation agreement actually, which dates back to 1994, is part of your materials that were sent out in advance of the meeting. But basically that agreement was a fairly loosely defined agreement that says we're going to create a joint advisory committee. Now that advisory committee has sort of changed over the years, but it basically said we're going to look at how we can have a relationship that involves having JCDH staff, and I will refer to our health department, Jefferson County Department of Health, as JCDH, and School of Public Health is probably SOPA, sorry. It's our staff being adjunct faculty at the School of Public Health at UAB, and also potentially having School of Public Health faculty assigned to specific responsibilities within the health department itself. And again, over the years, we've actually had that. At about a year before I came to the health department, which will be almost 6 years ago, we had a faculty member from the school in epidemiology who was actually managing the department that I now lead. So that has certainly happened. We also, of course, wanted to look at internships and field placements. I think that's one of the easier and more natural relationships that tend to come out of academic health departments. There was a desire for job placement. That's a little interesting in the world that I live in. Maybe like some of your organizations, we are governed by a personnel board, so we don't get the option of giving preference to folks who might have come from one of our local schools of public health. And even more recently, we've now transitioned to behavioral-based interviewing, which again may not necessarily lead folks into that role, but what we're actually seeing is that folks who apply for jobs who have been through a public health training program, such as a master's degree, typically interview quite well with us, so that does help there. We wanted to look at technical assistance and curriculum consultation. That is something that's been ongoing through the years. We've also collaborated on many, many research programs, and we have a ton of information exchange. We find that there are things that we have here at the health department that are very useful to grant writing and even program production on the university side and vice versa. So this affiliation agreement, again, in our minds, sort of created us as an academic health department, although we weren't using that term at that time. One of the things we've learned is success breeds success. So having this affiliation agreement, we began to offer internships throughout the School of Public Health, their various programs. Those have been in place again since 1994. But right now that program is under revision. One of the things we're learning, and I'll say again, programs wax and wane. Sometimes you are stronger in one dimension of your academic health department than another. So as I came into the organization about 5 years ago, there was sort of a weariness, I think, about internships, and we started seeing a little bit of a decline in those internships. But more recently, we have had a joint meeting with some of our folks and School of Public Health, and there's a deep desire for us to reinitiate and reinvigorate that internship program. Our dietetics program, which started us off anyway, has remained strong. We have several institutions, as you can see, that we currently use for our dietetic program and have found that to be very effective for us. We also do clinical rotations. We do those for dental hygiene and dental assistant students. I had a conversation just the other day with our director of dental health, and he commented on what good quality he's seeing out of these young people coming through. So we are certainly keeping an eye out for them when those applications come forward. Also, we offer clinical rotations in family practice and pediatrics, and that's a fairly long-standing process for us. And I can truthfully say that we have hired a number of our former students as residents, as pediatricians within our organization, and some dental students as well. So we have found that is helpful. It plays very well on the university side, giving real-life experience. And for us, it's not only the opportunity to be a part of training the next generation of providers, but also that we learn concurrently from them and their faculty members. We also have something we're very, very proud of, which is a pharmacy residency in public health. In fact, we initiated this whole construct back in 2004 with another local university, Samford University. It's a private institution that has a school of pharmacy. It was at that time our health department actually had dispensing pharmacies in each of its sites, and we needed some additional help and also wanted to encourage people into the field of public health pharmacy. Over the past years, we've had 15 residents who've completed. We have 2 that will graduate next week from our program as postgraduate year 1s. And for the next year, we're moving our program to a postgraduate year 2 starting in July and keeping the same 2 residents we had this year, which I think might be a testament to the satisfaction that pharmacists have with our program. They're sticking with us. We're very excited about that. This group of folks have really helped us meet some of the unmet needs in our community. We're very, very proud of them and of the program. There's also other things that we provide to support our academic partners. Again, some of us, or I do actually do, adverse drug event detection monitoring and management education with our pharmacy residents and also with the students that come with those residents to our facilities. We provide the adjunct lectures and guest lectures, faculty status for the School of Public Health, but also for other graduate and undergraduate programs within the university, such as the Department of Engineering. So we're certainly not just centric only on public health. And then several of our staff, myself included, are preceptors for the Samford University McWhorter School of Pharmacy, and that has been a great joy to work with those young people as they go on and to see their successes growing up in their careers. Something that is brand new for us, and we are just absolutely tickled pink about this, is that beginning this fall, we will be offering a clinical nurse practitioner residency within the Jefferson County Department of Health in adult health primary care. This is sort of a mutually needed thing. I will be honest with you to say that we have nurse practitioners currently providing patient care within our health department, and we're finding that a lot of them are fairly new graduates within the last year or 2, and that their comfort level really with the practice level that we need is not as strong as what they would like or that we would like. So this is sort of answering a problem that we actually see ourselves, is that we'd like to see folks a little more developed when they start working with us. And this has been just overwhelmingly accepted by our School of Nursing. They're delighted about this program, and for us, this is something really new in our area to offer that sort of postgraduate training as a clinical nurse practitioner. And you think about physicians and dentists, a lot of them do go on to fellowship type things, so this is sort of in the lines of that. It will last for 1 year, and what's very exciting is these folks will actually be hired as employees, and then there will be the potential for their continued employees with us after their 1 year of training ends, and we are hoping to have 2 of these students by the fall. Some other things that we have done within our academic health department, besides the training component, is that we've realized our academic partners can be very helpful to us in either expanding or enhancing the service that we already provide here at the Jefferson County Department of Health. And as you can see, we have contracts with our Division of Infectious Disease, who actually provide services in our STD clinic, to our School of Optometry, who provides vision services for our patients, for the School of Dentistry, who provide dental services that are beyond what our core dentists here at the health department can provide. And then the School of Pharmacy does provide a lot of medication, counseling, and assistance, and also lifestyle modification information for our patients. And all of these have really, I think, really helped us in starting to address some of the chronic disease situations that we have going on in Jefferson County. Another aspect of academic health departments that's fairly common is that health departments partner with their academic agencies to either submit for or conduct grants and research. And we have tons of this. These are just a few examples, but one of our long-standing relationships has been with infectious diseases at UAB related to STDs and HIV prevention. So as you can see, that's been going on for quite a while. A more limited project that we had in 2011 and 2012 was with the American Pharmacy Association Foundation for a project they call Project Impact. And this was looking at folks with high-risk diabetes and helping them get their disease under control. Since diabetes is one of our leading causes of death and we have one of the highest prevalence rates of diabetes, this has been especially helpful to us. And one of the neat things about this grant is that it allowed us to do things that we are prohibited by law from doing otherwise, which is providing direct patient supplies to our patients. So where we know with diabetes how important self-testing is and how important medication taking is for our patients, this grant's money allowed us to buy testing supplies for these patients and also to help offset some of the co-pays that they were experiencing. We saw some tremendous improvement in clinical outcomes as a result of this grant, and we are very grateful for that. That grant actually led to a local grant with a community foundation here in Birmingham that is helping us improve and expand that work by looking at folks who are urban residents, so generally Birmingham-centric residents, of folks with newly diagnosed diabetes, those with high-risk diabetes, and also those with pre-diabetes. And this grant is allowing us to do some of our work right out in the community, which is great. And we're also working with CDC to make our diabetes program ADA approved. So and that was with a grant we received from them. So just some examples. As a result of all that research and all this collaboration we've had, we have come up with quite a few publications and presentations. I've just highlighted a few of them, but the point I wanted to make with this slide is that it's kind of all over the place. We have had contributions to the field of environmental health, to direct patient care provision, but also to healthcare policy as well. So these are kind of work that I think would be very difficult for us to do here as a health department just based on time of our staff and other commitments. So having these academic partners has really, really helped us in that way. Probably the thing that comes first to my mind, though, when I think about what is the benefit of an academic health department, for us here, Jefferson County Department of Health, it was the support we received for our public health accreditation. There was just substantial contribution through our academic partners, particularly UAB, in preparing for our application and actually uploading our documents. This may be very familiar to many of you. I hope it is, and that you are, if you are not already accredited, or if you're on that trajectory, these are things that if you haven't thought about using an academic health department or relationship to do, that you might want to consider. We really relied quite heavily on our community health assessment work with UAB. I have a fairly small team here of all master's or higher prepared folks, but we're a pretty small team, and we needed help to cover almost 700,000 people living in our county. So our School of Public Health stepped in to help us. They helped us with distributing surveys, helping us in the design of those surveys, but probably most important to me was the analytics. Some of the things were numeric, and those were relatively easy, of course, for us to analyze here, but we had reams and reams and reams of qualitative data that needed to be analyzed very thoughtfully, and they did an absolutely wonderful job with that. So they contributed in that way very substantially to our community health assessment. As you all know from the Mobilizing for Action for Partnerships and Planning process, that, you know, one of the steps involves actually prioritizing the work and then selecting priority areas. And their data really was so helpful to us when we got down to about 15 themes that we could take to our community and get their input on to narrow that down to a manageable 5 things that we included in our community health improvement plan. Our community partnerships, and during our survey itself, the academic partners were part of the interview that was done with those community partners, and apparently they were very nice and glowing to us, which was helpful. But more importantly, we had multiple examples of how our partnerships had been a place in other things in our organization. So again, that's very helpful. And I got to ask a question now. Are you all seeing the screen? Because I have lost mine. I'm not real sure what to do. I should not click. Anyway, I may have to ask you ladies to advance my slides at this point since I've lost control.
Hi, friend. We're fixing that right now.
Here we got it. We're back. Okay, thank you. Appreciate that. So, obviously, our Community Health Improvement Plan was highly generated by our Community Health Improvement Plan, by our CHIP and our CHA. We're all linked together. And, again, our school public health and our relationship there was quite helpful in our writing and editing of that plan. Before we started our CHIP and CHA, however, we had done a strategic plan which actually is expiring at the end of this year. And that process was led by faculty from the School of Public Health back in 2010-11. And again, we were grateful for their help. They had lots of good ideas on how to structure that. And our health department had really not had a staff engaged process for strategic planning for many, many years. So they added very much to that. Another area where we felt a lot of support was in workforce development. Again, our School of Public Health provides lectures and offers our employees the opportunity to train with the students. In fact, one of the things they have just recently offered is they are eliminating the additional fee for online classes for their programs to our health department staff, which makes it more accessible to them. Another area where we looked and we used a lot of our work together was in the contributing to and applying the public health evidence base for standards 10.1 and 10.2. Again, this really comes back to a lot of that research that we've done, the publications that we were able to provide as a part of that. And then this might be something that's a little off the wall, but it worked for us, is in Domain 11 of the financial management standards have one where you have to show contracts that are helping you move forward. And actually, one of the contracts that we used, as it worked out during our application, was a contract with the School of Public Health for their services in helping us prepare our CHA and CHIP. And anyway, that worked out real well for us, so I thought I'd throw that in. Again, I don't know how we would have done it, honestly, without their help. I guess outside of possibly having to have spent a lot more money on some outside consultants. They were very reasonable and very engaged in our process and really did help us throughout that entire process. If you haven't thought about them, I really encourage you to think about them. I think it's a win-win on both sides. We found for the faculty and staff that worked with us from UAB that they learned a lot from it as well. It was a very practical application of much of the knowledge that they had, and they felt so much a part of our community is doing that. So I thought I'd give you a couple success stories, but I got to brag a little bit. I guess for me, the number one thing is that, again, with the help of our academic partnerships, we did achieve FAB accreditation in November. So I know many of you have gone before us, and we appreciate you all because we have learned from you. And for those of you who are considering or are in process, please let us know how we can help you. It's a tough process, but I think very rewarding one. But again, we would have had a harder time achieving this without our academic health department. Another success for me really gets into more kind of public health kind of things. And as I thought about our relationship with Stanford University and its School of Pharmacy, just over the past 12 months, we have seen our patients with high-risk diabetes, those are the folks whose A1C is greater than or equal to 9, have achieved a reduction of 2.6%. That's fairly impressive. In fact, a few years ago, we in one of our other studies, we had a 2.1% decline in a year, and one of the endocrinologists to whom we have a referral relationship called us up and said, "What are you guys doing? That's fantastic." So We feel like, again, having these pharmacists working with us has been a tremendous advantage to us. Another thing, of course, getting into core public health, we'd like to prevent people from having diabetes in the first place. So we do have a pre-diabetes clinics that we operate here in our centers and also in churches throughout the community. And as a result of their involvement with those patients that are out in the community, we have seen a less than 10% conversion rate from pre-diabetes to diabetes, which is truthfully a success. We know that that will really help these people going on through life. Something that has come out of just the world that we live in, and I don't know if this is true of your communities or not, but we have seen an explosion in opioid-related deaths in our community. I mean, they have just been on a tremendous rate of increase over the past 2 or 3 years. And as a health department, we've been very involved in changing some laws in Alabama to make the rescue medication, naloxone, available to those individuals who need it through, again, changes in the law that allow people other than pharmacists and physicians to dispense that. And one of the things that we have done is we've implemented a naloxone clinic. The people that come to this clinic might be a user of opioids. They might also be a family member or a support person for someone who is. And we also see healthcare providers who want to help other folks as well as law enforcement representatives. So we have dispensed 156 naloxone kits to individuals in the community. We will be continuing that clinic over the next few years. We're actually changing our mechanism from being an injectable medicine to a nasal instillation medication. And as we go forward, we're going to be asking folks to call and just let us know if the kit has ever been used. So we feel really good about that. And again, we know we're already seeing a reduction in our opioid-related deaths. We feel like this clinic is part of that success in our community. So when I think about academic health departments, again, I know there's a lot of variety. And many of you are doing things that we're not doing, and maybe we should begin, and maybe some of you are not doing some of the things that we do. But one of the things I want to talk about are some of those attributes, because there's no recipe for being an academic health department. It's not A plus B plus C equals AHD. You can be involved in any of many type activities. But generally, I think you almost always will have involvement with at least one academic institution and a health department. And again, those can come in a lot of different varieties and sizes. Having written partnership agreements between these institutions is helpful. It really does formalize it, but I can honestly say that the way our relationships have developed, particularly with UAB, is that if our affiliation agreement, which was put in place in perpetuity anyway, if it went away, we would continue to work. The relationship has become so solid. But in the beginning, it was needed to help keep everybody on track and to really be committed to the process. Shared personnel, again, there are some health departments who do that with their academic partnerships really, really well, one of those being the University of Tennessee and Knox County Health Department. We currently do not share personnel with our two academic agencies. We may have relationships, such as being preceptors, but it's not a paid type relationship that exists there. Having organizational structures that allow there to be resource sharing is very, very helpful, and that has happened with us, with both of our partners, all of our partners from time to time, and some very consistently. Sometimes it's sharing of software. For example, UAB has had a more robust SurveyMonkey license that we used during our community health assessment process that was very helpful. It saved us a few dollars because we didn't have to purchase it. We really did appreciate that. We have GIS support that comes from some of our academic departments as well, as we're beginning to become more competent with that, and then the exchange of resources. Some other things that are attributes of academic health departments is that they are providing that education and training for the students on the academic side, but also education and training for the public health professionals, so it's done on both ways. And again, we find that we learn a lot from our academic partners, and particularly as we're dealing with sometimes novel situations that are a little bit flummoxing to us, we have found that our academic partners sometimes can bridge in the middle of that. They can help us with looking at it from a different kind of perspective theoretically, and also sometimes when there is tension in the community related to what's happening, we have found them to be excellent partners. We do propose and implement research projects, and many academic health departments do that, but it's not a requirement. Again, I think it depends on how you're set up. We do expect shared support for and participation sometimes in public health service provision. For our organization, the shared support is incredibly strong. Several years ago, our health department was under siege for our funding from the state legislature, and our school public health really stepped up for us to say why that an earmarking our funding would be not a great idea. We really appreciated that. We were successful at that time with that. The collaborative and mutually beneficial relationships, I can't really express enough. It occurs in so many ways on both sides of the table. I think that we all become stronger as a result of those. So those are just some of the attributes. I wanted to just briefly kind of highlight some things we're doing, because academic health departments do change over time. One of the things we're working on right now, and I mean literally right now, is core competency assessment using the core competencies for public health professionals developed by the Public Health Foundation. We're doing that assessment again, and we will be using the results of that to develop our workforce development plan for our staff for the next year. And we fully expect that School Public Health, along with other players such as Public Health Foundation, will be helping us plug those holes or those areas where we have some opportunity for improvement. The School of Public Health at UAB is currently revising its practicum program. Again, I expressed to you that we had kind of waxed a little bit with it and gotten a little, kind of moved away from it about 5 years ago. And although it's never really completely stopped, it hasn't been as robust as what we would have liked. So we began that process in January of this year, just having a very heartfelt conversation where we looked at what had worked well, what had not worked well, what we wanted to see changed, and we've made a lot of improvements in that process. And what we expect to see is just a little bit more rigor added to that process. If some of you were able to hear Louise Kent several months ago when she presented about their academic health department, I think Louise has one of the most well-developed programs with her academic partners that I've seen, and we are stealing shamelessly from Louise. We also are using GIS training and utilization work. Again, we recognize the beauty and the benefits of GIS, but a lot of our staff have not had formal training, and we have some experts within our partner agencies, and they are working with us to help build our capacity in that way. And I got to just say, I had a moment on the next one. Our strategic plan we're currently in ends in 2016. It begins a new one in 2017. And it will end in 2021. So it's actually a 5-year plan, and once again, we are using assistance from the UAB School of Public Health in developing that strategic plan. Something that we're doing a little differently from what we did in the past is actually we have a doctoral student from the Healthcare Organization and Policy Division who is researching best practices for us in some of the evidence-based work that is happening in your health department. So as we try to tackle some of those problems that you may be a little ahead of us on, she will be helping us pull those together. I already mentioned our Nurse Practitioner Residency program, again, to begin in the fall, and then our postgraduate year 2 pharmacy residency that starts in July. So this all to say, the projects change and the people change. These are not stagnant programs. Some things that we have learned, I guess, over these years is that first and foremost, you need someone to really push the issue. That's probably you because you're on this phone call. But be that someone. If you see an opportunity to start an academic relationship, begin it. If you are the person who says, wow, we're doing some of these things, but we'd be interested in doing something else, be that person. Go out there. I think what you'll find is that you'll You'll find most of your academic partners, if you're on a health department side, are pretty willing to work with you. We certainly have found that in our organization. I really want to encourage you to take advantage of our academic health department mentorship program. And in just a minute, we'll tell you a little bit more about that program. But what I have found is that none of us know it all and have it all together. So together we learn. You have things you can teach me, and I hope I have some things to share with you as well. You need to start where you are, but looking for those natural synergies between your agencies, whether you're on the public health provision side or if you are on the academic side. And what you may find out is that you're already an academic health department. You just haven't given yourself that brand at this time. Again, letting those smaller successes breed the larger ones, that really has worked for us. And so as we come into new areas that we could try, we use those small successes to say, hey, this is a good reason why we think this will work. It can work for you as well. We encourage you to in maximizing opportunities, to realize it takes some time. Not everything you do will be a home run for you. Some things will probably be failures. And it's important to have the right partners. And I know in talking with some of you outside of these phone calls, that you said, oh, you know, we tried it with so-and-so as an agency, and it just didn't really work so well. There didn't seem to be that interest. And that may happen, but there are other partners out there. It may be a community college you begin with and not a school of public health. Again, I want to say it's not always a smooth road. There will be bumps, and especially as you look at how you have different personalities involved. I've been through about 3 partners on my side in the 5 years, and they have all been absolutely wonderful, but they had different interests and they had different things to bring to the table. So it does require some adjustment over time, I think. Embedding an academic health department as part of your organizational strategic plan can really help you if you don't already have that relationship put in place. In fact, we had that in our previous strategic plan, that was something we intended to grow, and I think that has helped when you need the resources to do the work you do. We certainly have learned that leveraging your academic health department relationships for accreditation is both efficient and effective, and again, very much valued from our side. And again, I will stress again, something I think you all know, is that we're all learners, but we're all teachers at the same time. This isn't, you know, one group coming and telling you how to do it. It's very much mutual. And I have to say, academic health departments are fun, and they really are rewarding. And with that, I will answer any questions that you may have.
This is Bill Bryn. I just want to break in and thank you so much for spending your time with us today and sharing with us your experiences at your health department. Our intent was, of course, to give our participants an opportunity to get a look at a well-functioning health department that's been involved with academic institutions for quite a while and has become, quite frankly, relatively sophisticated at doing this. So I think you can all get a sense of what the potential is for a health department that's interested in this and has the good fortune to be around some academic institutions that are willing to partner with them. So please let me encourage you, along with Bryn, to ask any questions of her that you might have. Please go ahead. You could unmute the phone if you prefer at this point of discussion, or type something into the chat box.
Yep, thank you, Bill. And as a quick reminder, if you want to unmute your phone and join us in the discussion, just press *6.
I see a question from Claudia, and she said, I had mentioned that UAB faculty had responsibilities at the health department. How is this accomplished without payment? Actually, we do it with payment. We actually contracted for that service at the time. And in the 5+ years that I've been here, I have an annual contract with the School of Public Health, and essentially what it does is I pay for 1/2 of the salary of a doctoral student within the School of Public Health, and the school pays for 1/2 of that doctorate student's salary, and we get support from them. Their faculty members, bless their little hearts, get to do it for free. But at that one time when we had the epidemiologist on team, we were actually paying him for his time.
Awesome. Awesome, thank you. And Bryn, we got another question while you were giving your presentation. Is the affiliation agreement you have updated, or is it renewed automatically? How does that process work?
For us, it's renewed automatically, and as I mentioned, I was looking at it just recently going, we really don't have that advisory council with 3 members from the School of Public Health and 3 members from the Health Department as a formal entity that has become, again, it's become so much a part of our being that we don't have it. But we still have those concepts embedded in how we'll work together, and it's really worked out very naturally for us. So we consider it to be, it was one that was put in place to live forever until somebody wants to change it.
Thank you. And we have a couple more questions. You mentioned using nurse practitioners. Do you also contract with the College of Nursing?
We don't. At this point, we don't have a specific contract with our School of Nursing at UAB.
Okay. And how do you develop a quality internship opportunities?
I think this is an area where we are still working, and to be just very truthful with you, Stacy, I'm not sure that all the time that our internship opportunities have been quality. I believe they were intended to be, but what we have seen happen, or we're hearing happen from School of Public Health, is sometimes our students, come in with very specific ideas of what they want to do, and then we don't really help them self-actualize in that way. So one of the things we're working with is going to be a contract. And again, this is Louise Kent's forte. She can tell you so much more than I can about that. But we will be developing job descriptions for what we want, projects we want, but at the same time, a student in the school can suggest a project or an area that they'd like to work in that we can either accept, modify, or reject outright. Once we have some mutual agreement over what the project is, we'll actually have a contract that says, in support of this, the health department will do this, 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 and this. The student will do this, this, and this. Their faculty mentor on the university side will have these responsibilities. That's embedded with metrics and follow-ups of evaluation to make sure those things are happening. I think that is really going to help this program fly. And again, some areas here do it just absolutely fantastically. We have had interns who just didn't want to leave. They loved working here so much. But I think sometimes other folks felt they did not get as much as they could get. And one of the things we've learned, too, is that when we bring interns in, a lot of times we do, the show and tell thing where we drag them around and spend a day with an environmentalist, spend a day with the food people, spend a day with the immunization folks. And that's really not where we want our interns to be. So we're planning to do sort of a survey type of experience that will be kind of rapid fire over maybe 2 to 3 days, where before they create an internship, they will have an experience seeing some of the things public health does in real life. And then they'll be asked to do some reflection on that and determine where they see themselves working before an internship is created.
Thank you, Bryn. So we put some links in the chat box as well, where I know Bryn's mentioned several times that Louise Kent gave a presentation at our last meeting, or 2 meetings ago, I guess now. And so we do have the archive available of that presentation at the link that's in the chat box if anyone's interested in going back and looking at it as well as several resources that Louise shared related to the internship program that they operate at their health department. Do we have any more questions?
Looks like there may be one coming.
Mm-hmm.
Okay.
And I saw, Bryn, as you were talking about your success story number 1, you received some congratulations on achieving accreditation.
Thank you. That was worse than having babies. I'm glad we did it. And for those of you who haven't made that decision, I think we are a better health department because of it. I really do.
I don't see anyone else, or
Bryn?
note that anyone else is typing at the moment, or are there any remaining questions?
I do have one.
Yes.
This is Janet Shipman. I'm calling from Memphis, Tennessee, and we already provide internships for several different schools. When you're considering an academic health department, do you think it's best to separate institutions and have separate contracts for each of them as opposed to having sort of a joint collaboration maybe between two universities in the health department?
Wow, that is a great question. I haven't really thought of that. All of ours are separate.
Okay.
But again, sort of the programs we're working with are fairly diverse.
Mm-hmm.
On the other hand, I think I've just learned something, especially with our dental hygiene and dental assistant students where we have multiple players. We do need to look at maybe looking at how we could standardize those. I like that. I think it really just depends on where you are, Janet, in your work. Sometimes it's easier to have it all together than separate it.
Well, if you don't mind, I'm going to keep your number and refer to you as we continue to develop, because we currently have affiliation agreements with a number of institutions, but we want to formalize into an academic health department for public health purposes with both the University of Memphis and the University of Tennessee Health Science Center. And I'm just trying in my head to imagine whether there's a value in trying to put it all in one document with three parties, or it would be better for us to have separate documents with each. And
our piece of it, I think, could have some problems with getting the signatures you need when other institutions are involved. That would be the only thing I could think of that might be a limiting factor.
Okay.
Unless you're, and again, I'm sorry, I don't know if University of Memphis and UT are in the same system.
Actually, they are not.
That might be a little bit of a challenge for you just because of territoriality.
Yeah. Yeah. Well, thank you.
And I welcome your phone call.
Thank you. I appreciate that.
Good. Well, given that we're near the end of our time, I don't see any more questions at the moment. Maybe that's a good segue to the next slide. Because the next slide really is a notification to all of you, if you're not aware of it, that the Academic Health Department Learning Community has a mentorship program. And you, I expect, will be pleased and probably not surprised to learn that Bryn Manzella is the director of that. So we decided that one way we could help people deal with issues they come up against is to try to connect them with folks who have had experience in the area that they're interested in. And so we have developed a list of folks who are willing to be mentors and have connected a number of folks now with mentors to try to help them deal with particular issues they're facing. So we just want to remind you that that resource is there and is available for you. We'd love to have more volunteers of folks who would be willing to act as mentors in areas in which they have significant comfort, but we could also, of course, be interested in hearing from you if you would like to be connected to someone else that might be helpful. We want to share the learning that goes on with all of this. We want to share experiences and expertise. So please feel free to do that. You can join the program at the website that's listed on the slide. So we really encourage you, if this appeals to you at all from either direction, to go ahead. By the way, I guess you could also be both a mentor and a mentee, depending on what the issues were and what your experiences are. So please consider that as time goes on. And then in terms of additional resources, here are the web addresses, the email and web addresses that I think would help you keep up with what's going on with the Academic Health Department Learning Community itself, with the Council on Linkages and what it is doing, and with news from the Public Health Foundation. Because, as you've probably surmised, the Council on Linkages is fortunate enough to be staffed by folks from the Public Health Foundation, so we are closely tied to them. They have many programs, and we are just one. But we are always grateful for the good work of Kathleen and Janelle and Ron Bialik. So let me see. Have any other questions come up in the meantime?
I don't think so, Bill.
Okay. Well, the last slide then is just sort of an introduction to the Public Health Foundation itself. And as you can see, there are a variety of things it is doing. I'm sure many of you are connected with them through TRAIN or their Learning Resource Center and so on. So don't forget them and us as a source of help if we can manage it. Very good. So any other questions at this point? Well, we're right at 4 o'clock. So, Bryn, once again, let me thank you so much for taking your time to put all of this together for us. And thank all of the rest of you on the call for being a participant and sharing your questions and your congratulations for Bryn with us all. All right.